You all know that the GLP stands for glucagon-like peptide. So that's the GLP stands for. And actually, GLP is a naturally occurring hormones. And this is probably under the radar for a really long time, but this is a really magnificent hormones. And this hormone is produced by our intestinal tract when you eat food, and as the food goes through the intestinal tract, and GLP-1 is produced, and then it goes to the bloodstream, and it goes to pancreas, and and then the body tells to produce more insulin, and then also another important aspect is the GLP-1 suppressed another hormone, glucagon. Okay, so now at this point, we really have to understand the insulin and glucagon pathways. And we, of course, everybody talks about insulin and how important it is and how we can maybe treat diabetes with maybe insulin or insulin-like substrates. So we all very well aware of insulin. But sometimes even healthcare practitioners, whether they're in natural field or pharmaceutical field, they overlooked the importance of glucagon. And so pancreas produces about 4 or 5 different hormones, but or enzymes as well. But insulin, of course, is the most kind of well-known hormone. But glucagon is very, very important, especially when you try to treat diabetic conditions. And that should be balanced. If this insulin and glucagon balance is imbalance, and then you will have a very difficult time to treat the diabetic conditions. So when you eat the food and then the pancreas produce insulin, so the glucose in the bloodstream is broken down to glucose, and the body can utilize the glucose. However, when there is too much glucose, and then the glucagon, actually the body has too much glucose, then body should synthesize the glycogen from glucose. Okay, and then the glycogen is stored in the liver and the muscle. Glucagon is kicked on, and then the body is looking for glycogen, and then breaks down glycogen and then back to glucose, so body glucose can be utilized. So during the between the meals or when you fast, and then the glucagon has to be kicked on, so your body can be supplied with glucose. So okay, so the glucagon is very important. Now, GLP-1 is incredible, and so that is how first the GLP-1 is kind of extracted, and it really does incredible health benefits, especially when people trying to lose weight. GLP-1 really, really works. But GLP-1, one of the functions is suppressing glucagon. Okay, so when we are dealing with naturally occurring GLP-1, you have a pretty perfect balance of insulin and glucagon. But when you are keep taking GLP-1, and there is a big question that we have to ask. Okay, if glucagon is continuously suppressed by taking GLP-1, what are we going to do when we have to have glucose during the between the meals and also during the fasting period? Okay, this is a really big, important question. So people just look at the benefits of GLP-1, but there is also some concern associated with this GLP-1. Okay, so when you are helping your patients or your clients who are taking GLP-1 regularly, and then you have to also check with insulin and glucagon balance. So what do we do? Okay, they're taking GLP-1. There's so many people are taking GLP-1 now, and even teenagers now start taking GLP-1 to lose their body weight. Okay, so then how do we help them to balance insulin and glucagon, pathways? And so one of the new products, of course, tonight is more about the Epizen, but one of the new products that we had this year is glucoiso. Glucoiso is kind of designed to balance insulin and the glucagon pathways. So please keep that in your mind before we go any further. Okay, so same thing, this synthetic or, you know, this external GLP-1 is kind of mimicking with the naturally occurring GLP-1. So, but again, if you continue to take GLP-1 more than the amount of naturally occurring GLP-1, then there might be some concerns that you want to make sure that your clients and patients are not suffering from it. Okay, and there, because of those concerns, and I think the market kind of recognized that some concerns associated with the GLP-1, and the GLP-1 can also deplete some multivitamins and enzymes and proteins and so on and so forth. So there are some the marketers are kind of took advantage of it, and there are several products on the market that support, the GLP-1 protocols. This product is actually available through Walmart, and now if these products are available, and this product is designed to support those who take a GLP-1 regularly, I think the public is now finally recognizing the some concerns associated with the GLP-1. And this is called Ozempic phase. Ozempic is one of the many GLP drugs that are available on the market. And because of that concern that I have mentioned, your skin integrity, your muscle mass is really compromised while you're taking these GLP-1 drugs. And these are some typical examples, but this is more like superficial examples of GLP-1 side effects or concerns with GLP-1. But if this superficial appearance is influenced by GLP-1, what about your internal organs? Remember that your internal organs are made with muscles and especially heart muscles. So if your muscles are compromised by taking GLP-1, and then, just like your superficial influence by the GLP-1, then there is some concerns that you really have to make sure that your clients are not suffering from it. All right, so this is a kind of I guess it's a pretty typical fatigue, is a good sign of the GLP-1 side effects because it kind of slows down the emptiness of the stomach and you eat less and less and less. And it happens so fast. And there's no other way but the people must experience fatigue. Okay. Then what we have from Inno-Vita to support, those people who are taking GLP-1. So we have a Leptera protein support. Of course, the protein is very important when you start losing muscle mass, and all the tissues and muscles are all made out of the protein, and you have to provide some building blocks. So that's Leptera is listed here as GLP-1 support protocols. And then calcium, of course, when you lose your weight that fast, your bone densities also kind of go with it. Okay, so you lose bone density. So when you're taking GLP-1, calcium supplementation is very, very important. Okay, collagen, of course, is very, very important as well because your skin. We just saw previous, the slide, and to prevent that, collagen is very, very needed. Okay, and the magnesium. Okay, so GLP-1, I told you at the beginning of this virtual training, GLP-1 stimulate insulin production. So your insulin is probably produced more than usual while you're taking GLP-1. And then the integrity of insulin itself is easily compromised. To support that, magnesium is very, very important. Okay, so that's why I included the magnesium to this GLP-1 support protocol. But just as I said it, I just remember the kind of one condition. So when insulin is overproduced by GLP-1, GLP-1 kind of stimulate insulin constantly, and then insulin may not be fully utilized by your body. Okay, so unutilized insulin also stimulates insulin insensitivity. What that means? That also leads to insulin resistance. Okay, so that's another thing that you may want to check, when you help with the GLP-1. Minerals, of course, and vitamin D is also important. Vitamin B complex, fulvic Keva digesta. Verdance is also very important. Verdance is pH balance. And when you lose your weight that fast, and then you start kind of pulling protein from your muscles, and then the body can lead to a condition called ketoacidosis. Okay, ketoacidosis can really mess up your body pH. When your body becomes more acidic, your body is more susceptible for genetic disorganization. Okay, so when you take a GLP-1, your body tends to become acidic by this ketoacidosis, and then you want to avoid that. You need to balance pH by taking Verdance.